Hi, welcome to Future Nurses YouTube channel. Please subscribe and support our YouTube channel. So let's start today's video. So the first question is blood flow in the upper extremity is assessed by. So the blood which is flowing in the upper extremities is assessed by which of the following test? So the correct answer is AIIMS test, which is done to test the blood flow in the upper extremities. So AIIMS test. So next question. Physical regulation of body temperature by the loss of heat is. Physical regulation of the body temperature by the loss of heat is thermolysis. It's called as a thermolysis. So next question. The most common deficiency seen in alcoholics. The most common deficiency seen in alcoholics is thiamine. So the patients who is alcoholics, thiamine deficiency will be commonly occurs. So coming to next question. A safe method of open the airway of an unconscious patient with suspected spinal cord injury. It's called as jaw thrust method. So this is the very important question. Okay, jaw thrust method, it's used for the to open the airway of an unconscious patient in a condition with suspected spinal cord injury. Okay, so coming to next question. ICN adopted the code of ethics in the year. ICN adopted the code of ethics. Code of ethics in the year. ICN means, so it's a council for nurses. So 1973 they adopted the code of ethics in 1973. So next question. Drugs used to decrease gastric motility. So drugs which is used to decrease gastric motility is anticholinergics. Anticholinergics which is used to decrease the gastric motility. So next question. Coplic spots are seen in. So coplic spot are seen in rubella condition. Okay, so next question. The anti-tuberculosis drug that can damage the 8th cranial nerve. So streptomycin, it is the anti-tubercular drug that can damage the 8th cranial nerve. So please remember 8th cranial nerve, which is damaged by the streptomycin, anti-tubercular drug. So next question. An antiplatelet drug is given to a patient with myocardial infarction. So in a condition myocardial infarction, the antiplatelet drug to be given is aspirin. So aspirin is a antiplatelet drug. So next question. Insertion of a catheter into the renal pelvis by a percutaneous puncture is. So it's called as a one procedure. Okay, insertion of a catheter into the renal pelvis by a percutaneous puncture is nephrostomy. So please remember this answer also. So nephrostomy. So next question. Tab digoxin. Tab digoxin should not be given when a patient has. So this is contraindication of tablet digoxin, bradycardia. So when the patient is having bradycardia, so tablet digoxin should not be given to a patient. So next question. A disease that can arise from normal bacterial flora, especially after prolonged antibiotic therapy. So, the disease that can arise from a normal bacterial flora after a prolonged antibiotic therapy, it's called as candidiasis. So, next question. A blood transfusion reaction is. So, the blood transfusion reaction is also called as cytotoxic hypersensitivity. A blood transfusion reaction is cytotoxic hypersensitivity. So, coming to next questions. Menstruation is inhibited by. Menstruation is inhibited by progesterone hormone. So, the hormone called progesterone, which inhibits the menstruation. So, coming to next question. Epinephrine is secreted by. So, epinephrine is secreted by adrenal medulla. So, next question. Sick test is done in diphtheria condition. So, next question. Ascites due to cirrhosis of liver is managed with the diuretic drug. So, ascites due to the cirrhosis of liver is managed with the diuretics aldactone, which is the diuretic drugs aldactone. So, coming to next question. A drug used to reduce blood ammonia level to prevent hepatic encephalopathy. A drug used to reduce the blood ammonia level to prevent hepatic encephalopathy is lactulose. They will use lactulose drugs. So, next question. The most reliable physical assessment indicator of low oxygen in the blood. So, if there is a low oxygen in the blood, the most reliable physical assessment is cyanosis of the oral mucosa or conjunctiva. So, cyanosis will occur. So, coming to last question. Trendelenburg position is not used in. So, they are asking the contraindication of the Trendelenburg position. It's called as dyspnea. So, dyspnea is the condition where Trendelenburg position is not used. So, friends, we have come to the end of the video. So, please subscribe and support our Future Nurse YouTube channel for your upcoming AIIMS NORCET in 2024 and other competitive nursing officer examinations. Thank you.